Hey guys, today we're going to talk about polishing and Prophy paste. So the first thing we're going to start off with, I want to go over the basics of what you'll be using when you're going to polish a patient. Here, Dominique, come on over here. So the simple different armamentarium that you will need for polishing. The first thing we're going to have is a polish brush. This will be used on patients that have ortho, where you're trying to get around brackets, patients with lingual bars, where you're trying to get up underneath that bar. Most of the time in clinic, you're going to be using what we call a Prophy angle. We talked about these in class. And this is going to help us polish all the teeth to remove any extrinsic stains that could be on teeth. And then at every office you go to, you'll probably have a different selection of polish paste. In our clinic, we have this mint flavored coarse polish paste. There's also a medium and a fine grit polish paste. And then the other one we have in our clinic is a sensitivity paste made by Colgate. Now this polish paste can be used on patients with recession, anybody with sensitivity. You can actually even use it before you try to scale them. It'll help desensitize those roots sometimes and make your life a lot easier during the cleaning. Then the other thing that you're going to be using is your handpiece. Everybody has one of these. It's the Midwest RDH handpiece, and it's very simple. Right here is the little attachment. So you'll take your Prophy angle, line up the hole to the notch in the handpiece, and just push down where it fits in all the way. And then you can leave this in your holder. So I'm going to be polishing Dexter today, so everybody can follow along with what I'm doing. We're going to put all of our PPEs on, our glasses. Those glasses lean, that's okay. Our mask. And then lastly, you guys know this, we don our gloves. Alright, so now that we're all set up, I'm going to come over here to Dexter. Grab my light. Always want to be able to see what you're doing. This is part of your assessment, is using appropriate light and infection control. So you'll have your patient in a supine position ergonomically like you should for your entire appointment. And what you'll do is you'll take your Prophy angle. We're going to open up our polish paste. And when you hold your handpiece, you're going to hold it with a stable fulcrum like you would an instrument. And I've got the cord wrapped around my pinky finger, so ergonomically this doesn't pull and weight me down throughout the day. The goal for polishing is you want to use this on the slowest possible speed that you can to accomplish your goals. If we hear this, whoop, that really high-pitched noise, that means our master switch isn't on. Apologize. We don't want to hear any real high-pitched noises where you're kind of going into the stratosphere with this polishing. This cup will heat up and can actually hurt your patient. So normally you're polishing and hearing that type of speed, and you can see how slow that's going. So what you'll do is you'll put a little bit of polish paste just to fill up the cup. You don't want to get polish paste on the outer portions, because if I put this in somebody's mouth, push the pedal, whatever polish paste was outside that cup is now going to be in my patient's face. So we want to use the slowest possible speed that we can to accomplish our goal. So what we'll do, Dominique, if you can zero in here, you're going to polish about 2 or 3 teeth at a time. We are going to start, I'm going to be here on number 22. If you can see that, Dominique?
Yes, ma'am.
Correct? Okay. So we're going to start on the distal part of the tooth. We're going to polish the direct facial, and then we come over to the mesial. You can see that I'm using an extraoral fulcrum the entire time that I'm polishing. You can also use an intraoral where you're fulcruming on the tooth itself and polishing the teeth. But we have to have a stable fulcrum while we do this. So we polish the distal, the facial, and we roll onto the mesial so that all aspects of the tooth are covered. Again, using a very slow speed, not a high speed. Now, what you're going to want to do is polish the entire lower arch, all of the teeth, and then when you're done, we'll put our polish paste up. We'll grab our air water syringe and our suction. Dexter doesn't have saliva, but normal patients will. So, we don't want our patients filling up too much with saliva. Oh, the pumps aren't on. That's okay. Filling up too much with saliva where it's uncomfortable. So what we'll do is we'll just rinse off what we did. You can actually blast the air water simultaneously, and then we suction. You'll do that for the top and the bottom arch until you're all completed. And we all talked about in lecture what the goals of polishing were: to remove extrinsic staining of teeth. Of course, it will not remove intrinsic staining. The other option to polishing would be to do air polishing with a ProfiJet. We'll demo that at a later clinic time for you guys. But those are the basics of polishing, and we're going to be doing this as an assessment in your lab class.